So hello, everyone, and welcome to today's program. It'll be all about the COVID-19 vaccination. You may be wondering, has it killed anyone, and have a whole host of questions. And today we have two medical professionals on hand. We have Dr. Christine Birnie, who received her BS in pharmacy from the University of the Sciences in Philadelphia and has continued her studies at that same institution, completing a PhD in the area of pharmaceutics. After a few years working in the pharmaceutical industry, Dr. Birnie joined the ranks of academia. In 2006, she joined the Wegmans School of Pharmacy as a founding faculty and was promoted to Department Chair, Pharmaceutical Sciences in 2010. She then became Dean of the Wegmans School of Pharmacy in 2017. Dr. Birnie has been actively involved in service both to the profession and to the global community at large. She's an avid proponent for service and volunteerism, both locally and abroad. She's led and participated in over 15 student-based medical mission trips all around the world and travels regularly to both El Salvador and India. She's served in elected positions and boards for the Christian Pharmacists Fellowship International and Advisory Committee for the Global Missions Health Conference. She remains actively involved in American Association of Colleges of Pharmacy and is a 2012 graduate of the AACP Academic Leadership Fellowship Program. And to assist following the presentation with any questions people may have, Beatriz LeBron comes to us from She Executes Healthy Kids Play ROC's campaign, developing strategies and tactics that advance play as a cornerstone of whole child health in schools and in neighborhoods. Key responsibilities for her include managing projects, convening the PlayROCS Advocacy Committee and key stakeholders, and engaging youth, families, and residents. She's served more than 19 years in the human services sector and has extensive experience as a supervisor, educator, trainer, and community health worker. With more than a decade of experience in policy creation, implementation, and oversight in healthcare and education, she also has extensive knowledge of New York State Department of Health regulations. And prior to joining Common Ground, LeBron served as a social worker, bilingual at Elder Source, Community Place, and Lifespan. Earlier, LeBron was a community health worker at Rochester Regional Health, where she worked with individuals facing social, economic, and other barriers to maintaining their health. So with all that, I'm tired just reading about all the accomplishments both of you have had. We're in very good hands today. I'll let Dr. Birnie take over.
That's great. Well, thank you so much for having me, and great to talk about this topic. As pharmacists, we've been heavily involved in the COVID vaccine rollout, as pharmacies have been given the opportunity to be able to give this vaccine locally, as well as health departments, hospitals, pop-up centers, lots of different areas giving out the vaccine, and of course, encouraging people to do so as a public health measure. So I know there are a lot of questions around the vaccine, and we're going to use some of this time and hopefully to be able to answer some of those questions and have time at the end for you to write in questions, or we have a small group here gathered, so you're welcome to even just say those out loud, or you prefer, you can type those into the chat as well. So I have a presentation here for you that'll give us some guidance that we'll go through. And if I can share my screen, it says right now that I'm not able to do that, but if I can, I will share the PowerPoint presentation. But this presentation will go through a variety of different topics related to the vaccine, mainly showing you some of the safety concerns, which is what I understand is the main concerns for this group would like to hear more about. So, and then of course that time to answer questions for you. So we'll put this into presentation mode so that you can see this a little bit better. Oops. And we'll get that a little bit easier to see. So let's see, can you see that well? Is that good in presentation mode?
Looks good.
Okay, perfect. All right, great. All right, well then let's go ahead and get started through this. We'll start off with a conversation about what is COVID, and likely you can answer most of that right now. We've been living it for the last more than 12 months now, and continuing to. We all thought we would hopefully be done with this by now, but we're living it for real. Then we'll talk a little bit about the vaccine and how scientists had a head start when they started developing this. And then why should you take the COVID vaccine, or why maybe encourage a friend to take it or a family member? And I know there are a lot of questions about that. And what if I have a pre-existing condition, or what about my age, or what about this situation? And so the best is to talk to your provider. You can talk to a local pharmacist, your doctor, a PA, a nurse, someone you trust, and someone who has the background and the training to be able to take all of this information and the data and the studies and really try to give some good advice based on your personal situation. So then let's get the facts, tell your friends, and then we'll do some time with question and answer, as we mentioned. So we'll start off a little bit of what is COVID, and just reminding people, you likely all know this by now, but COVID-19 came from the name coronavirus disease, so COVID from those letters. And the first time we saw coronavirus was in the very end of 2019. Even though we think of it kind of coming to the US in 2020, it appeared in China in 2019. And so that's why the number 19 is connected to that. If it happened in January, it would have been COVID 2020. So that's the number of COVID-19. Possible symptoms that can happen with COVID-19, and we've likely been hearing stories. You may have known people, you may even yourself have contracted COVID over the last 12 months. But people can have fever and dry cough, aches and pains. It's a lot of flu-like symptoms, quite honestly, and sometimes can be confused for that. It can also sometimes cold and cough, sore throats, chills, those types of things that sometimes we think, oh, it's no big deal, it's just a runny nose, when really it could be COVID and could really maybe be very minimal for you, but could really be very contagious and very much a problem for somebody with other disease states, or who might be an elderly, and can be very challenging. COVID spreads very easily, and that's one of the challenges here. It is airborne. It can spread even if you don't have any symptoms. So we may feel fine, but we're around someone else who can then pick up that virus through the air, and that's why the mask becomes so important. If we can mask, then we can prevent COVID from spreading. So, and that has been very, very effective over this last year. And even the incidence of flu and common cold is so drastically decreased this year, mainly for that same reason. They're also airborne. And I know for my own self, I typically have a cold a couple times throughout the winter, and I haven't had a cold since last March, I think right before COVID shutdown happened. So I'll knock on wood for that, because I don't know how long that will last, but I'm very happy to not even have a cold this whole past year. But I've been wearing a mask, or at home, right? And not out traveling, and not with people, and doing all the things that I would normally be doing the last several years. So how can we prevent COVID? Of course, wearing a mask over our nose and mouth, staying 6 feet apart, washing our hands, staying home when we're sick, all the things we've been talking about for a year. So all of that's kind of our crash course about COVID, and you guys can probably do that section of this presentation at this point. So let's talk about the vaccine. Scientists had a head start. So what do we mean by that? We have 3 vaccines out there now that have been approved by the FDA as an emergency authorization. So that means they have not gone through all of the long drawn out process that occurs for regular FDA authorization. What does this mean? This means that it's gone fast. That means the FDA has approved it, which might normally take 6 months for them to review all the documentation. Here they did it in a week, and they stopped everything, pulled all their people together, made it a priority. And this is, I think, a model for how we can move things through the systems when it really is important. But we did not compromise anywhere on any of the studies that are done, any of the human trials, any of the long-standing trials. In fact, in the these cases, we often had more participants in studies than we typically would for other drugs because we know of the widespread need that this vaccine was going to have. So we have 3 vaccines on the market right now: the Pfizer, BioNTech, the Moderna, and the Johnson & Johnson, which sometimes is referred to as Janssen or Janssen, you might hear it pronounced. And that is one of the Johnson & Johnson companies. So that's why we kind of hear those together. They all have a little different dynamics and a little different aspects to them, and happy to talk about the different ones. But they all stem from different aspects of research and development that has been happening for years. And some of the technology that has happened started way back, as far as we could say, even maybe to 2002, when we first started to see the SARS virus come in the market. And this is into the communities. So this was the SARS outbreak was back in 2002. We saw that come into play. Some additional work and testing was done over the next 10 years related to SARS. So this is a virus that we had some familiarity with. This is a different aspect of it, but very much something that wasn't brand new to us. This SARS virus, which is connected to the COVID or the coronaviruses. So in 2012, we had a coronavirus or a MERS outbreak. So a coronavirus, but we didn't use that term so much back then, but it's same terminology, same virus type in that way. We started developing different types of vaccines back then, 2012 to 2018. And then of course, in 2020 is when we started to see the coronavirus that we know today come into the market, with so much of the development happening over this past year. This past year, we were able to take all of that information we had from really the last almost 10 to 15 years, what we knew about SARS, what we knew about coronaviruses, even some of the mRNA technology that had been tried and utilized in different vaccines, was now able to pick up from that technology and move that forward into this last year of development into the vaccines that we have today for COVID-19. So what happens when a drug is studied and a vaccine, in this case, is tested? First, what happens, it goes into what we call phase 1 clinical trials, where we typically have between 20 to 100 healthy people. Here we test to see if the vaccine is safe. Does it work? Are there serious side effects? And if it passes through that and we say, well, it's safe, then we put it into phase 2 trials. That's where several hundred volunteers are utilized for these trials. And here we start to find out whether there are shorter term side effects. What's the body's immune response for these? Is this virus really working? Is it protective? So now we've got a little bigger group of people. That's phase 2. And then phase 3 is where we see thousands and thousands of people involved in these clinical trials. And here in some of these studies, we had up to 20 to 40,000 people in multiple countries involved in phase 3 clinical trials for all 3 of these vaccines. So when we get it out in that many people across so many different areas, everything starts to show up. We get to see whether there is really a problem, whether this is truly safe. Is it really working? Let's pull all this data together and then be able to compile that. And then only if that drug is safe, it will progress to being approved to move forward into the general public, as we have seen with these three vaccines. Phase 4 is for vaccines that are already approved. So the FDA approves them and we continue studying them. So it doesn't just stop then, because we know that once it gets approved, it's going to go out into millions of people. And so those studies will continue even after it's out on the market. And that's why we're seeing more and more data come through now. This idea of 3 months post after people have had the vaccine to make sure that they have the immune response. And so as more data becomes available, some more information is provided. And so these studies are continuing, and these drug manufacturers will continue to do these studies in children. They'll do them in pregnant women, all of the groups that we have all these questions about right now. That work just hasn't been done yet, but it will continue. It's going to take time to do that. It was so important to get this drug out on the market. So, and it is the case for any drug. We get it out, we do all the studies, we do all the things, but we continue working on those drugs or those vaccines even after they're out in the market. So the COVID-19 vaccines have had the same safety measures as all other vaccines and drugs as well. And a similar process occurs in these. Because the new coronavirus was so widespread, researchers could quickly see that the vaccine provided protection, and that's why we were able to move forward with those. So a lot of people ask, which vaccine should I get? There's 3 different ones. This one is 2 weeks. This one's 3 weeks between them. This one's 4 weeks between them. This one, I only have 1 dose. Is that just as good? And so really at this point, what we say, it's not really about which one is the best. There are pros and cons of all of them, honestly. The best vaccine you can get is the one that is available to you, because right now it's about production. It's about getting the vaccine out to people as soon as possible, because people are dying and people are getting sick. There are long-term consequences of COVID-19. And so right now, the best vaccine for COVID-19 is the one that is available to you. So who should not get the vaccine? And I know there's been lots of questions about that, of are there people who shouldn't? And again, your healthcare provider is the best person to talk about your particular scenario. But anybody who's in isolation or quarantine for COVID-19 right now, you should not get the vaccine. You should stay home, you should rest, you should get well, you should make sure that you're not getting the virus yourself. If you do, get on the other side of it first. So you should not get the vaccine if you're currently in isolation or in quarantine. And then anyone who was sick enough to get the COVID-19 vaccine disease and to get antibody therapy or convalescent plasma within the last 90 days. So if you were to get extensive treatment, drug treatment, or the convalescent plasma, so if you were really sick with COVID and you had some additional treatments, you should hold off 90 days until you get the vaccine. So there definitely are some limitations there. And then people who are having known allergic reaction to polyethylene glycol, we sometimes refer to that as PEG, or other polysorbates in the vaccines. So polyethylene glycol, being a pharmaceutical scientist myself, we use polyethylene glycol in a lot of pharmaceutical products. It's in food products. It's in a lot of different things. It's a very good solvent, and it's used in a lot of products. I have it in my lab right here at the school. So this isn't something that's unusual, but even things like peanuts or red dyes, or the things that are in a lot of other food products are people have allergies to as well. So these aren't really foreign products. These are commonly used products, but still people have known allergic reactions to them. So they should also not get this vaccine. And then right now, for anybody under the age of 16, has not been tested and is not recommended for anyone under the age of 16. So again, that may change in the future as we do some testing on people under 16, but that has not been done to this stage, so that is not being recommended at this point. So again, talking to your provider is really important. If you have some different medical conditions, you're pregnant or breastfeeding. I just recently talked with a friend of mine who's pregnant, and long discussion about whether to get the vaccine. In the end, she did, and she decided it was going to be better and safer for her and her pregnancy to get the vaccine. So she just went through her 2nd dose. She's fine, and she's very happy that she got it. Those who have severe allergic reactions, you have a bleeding disorder, immune compromise, or being vaccinated who are mildly sick, or just being over sick. So these, talk to your provider about those. If you have a health condition that you're concerned about, definitely seek advice before you get the vaccine. I highly, highly recommend that, because again, it is a personal decision for you, especially if you have some health conditions. Getting the vaccine is your choice. No one should force it on you. It is a decision. It is just like many other vaccines or medication you would take, or having a medical procedure. These can be recommended to you, and I think a lot of healthcare professionals will recommend them to you, again, depending on your situation. But in the end, you can choose to refuse any of the type of medical care or medication or vaccines, and that's for everyone. So we respect each other's decisions on those in that realm. So it is your personal choice in that realm. So why take the vaccine? Of course, my recommendation as a health professional is to get the vaccine if you can. So again, availability, health concerns, all to think about. But if you fit into those categories and you can get it, then please do. It really does help our herd immunity. It helps to reduce the disease in the communities. So lots of reasons to do this. One, getting vaccinated can help keep you and your family healthy and safe. So visiting with your family members. Okay, so this is huge. I'm sure many of you have friends and family, especially the elderly. I have parents who are in the 70s, and I've been very cautious to spend time with them over this last year until we just recently got them vaccinated. And, you know, my mother has a lot of health conditions. I know that if she had gotten COVID, I'm not sure she would have come out the other side. I was very nervous about that. And so we just recently got her the vaccine. And I'm very pleased to say, and we just spent Easter holiday together now, right? And looking forward to spending time with her again this summer now that we've gotten the family vaccinated. So we're excited about that. And that is the relief that you can have as a family after getting the vaccine. The vaccines will eventually let us get to a point where we don't have to wear masks anymore. That would be lovely, right? So for now, we still need them, right? There's still a lot of people unvaccinated. The virus is still out there. So we still need masks, but hopefully we'll get to a point where we don't have to wear them anymore. So we can have events and birthday parties, and we can socially gather again. We can go to the ball games. Getting the vaccine may offer natural immunity, but we don't know how long this protection is going to last. So that's another piece that we really want to make sure that the vaccine is helping us in that way. The vaccination is a safer way to build immunity, and it can help eliminate some of the major risk in severe illness and death from COVID. So just because you get the vaccine doesn't mean that you are completely free of getting the virus. You may still get the virus, and you still could potentially even give it to someone else. But the likelihood of you being hospitalized and you dying and having severe illness and death is extremely low. In fact, in the clinical trials, which we're going to see, there were no deaths reported from those who took the vaccine out of 20,000 people in the studies. So that is huge. And hospitalization as well. So did people still get the virus? Yes. Can you still get the virus? Yes, but very mild conditions typically, and no hospitalizations and no deaths reported in the virus from the virus in the for those who took the vaccine in the clinical trials. So that's huge. So you know, that's the risk, and that's what we're trying to desperately reduce the risk by having the vaccine. The vaccine will save lives. There's no doubt about it. We've seen over 500,000 people in America have died of COVID-19. And I'm sorry to anyone who has experienced that in your own families and your circle of influence and friends. I have known individuals who have passed away from COVID-19 in this past year, and it's heartbreaking to see the families that have suffered and individuals who have are moving forward from that situation, and it has been heartbreaking. Also, some of the COVID-19 can also have some long-term health effects, and we've seen that not only with the elderly, but also with some younger individuals. And although the younger are not as prone to getting this disease as we've seen, or they don't have as severe as symptoms typically, sometimes they do, and it's very unclear as to why, and sometimes having some significant health complications as a result. So that is a huge challenge and something we really want to try to avoid. If you get vaccinated, you feel a sense of relief. I just shared the story about now that my parents are vaccinated. It's a sense of relief for me. They can now spend time with my daughter, and we can go on family vacation this summer, and much takes that weight off of your shoulders, that I don't want to be the one that's bringing the COVID disease to my parents and be responsible for that, right? And now I can feel that sense of relief. The vaccine will also save jobs. It'll keep the restaurants open and businesses open. We know we've had some significant impacts to our economy. We want to fully reopen our businesses and fully restore our economy. And so if we can get the majority of people vaccinated and this disease either completely eradicated or minimized, we can keep all our businesses open, we can have all our events, and we can keep the economy moving. So it'll save jobs, which will be really wonderful. I had a couple points on safety, and I know that was a concern for many, and that you wanted to hear a little bit more about, so hopefully weaving some of these all through. But both the FDA, CDC, and New York State have independently had an advisory task force They have all approved the 3 vaccines with careful review and testing. More than 116,000 people participated in the clinical trials across all 3 of the vaccines. So about 40,000 people in each one of those studies, which is enormous, and really a large number of people to get tested. Many people are concerned about side effects or adverse events that might happen as a result of the vaccine. And there is a system in place, and this goes on for drugs as well as vaccines and has been in for many years, but even more so right now, that if there is people experience a side effect, this has to be reported to the FDA. This isn't optional. This isn't, oh, well, only if I, feel like. This has to be reported to the FDA. And that's the case for drugs too. There's a centralized system for that. So everything is being reviewed and compiled to find out what those side effects are. If there are significant adverse effects that occur, then that will be monitored. And drugs are sometimes pulled off the market. Vaccines can be pulled off the market. These could be as well if we find that there are too many adverse events. That has not been the case to date, and we don't anticipate that, although sometimes we don't see these things until they get into the large masses of people like we're seeing now, into the millions. And so those can happen, and there's a system for reporting that. So a lot of people will say, what happens after I get the vaccine? I hear about all these side effects, particularly sometimes after the second dose. But having an immune response to the vaccine is normal. And sometimes feeling that, you feel a little bit of a headache, I have a little bit of a low-grade fever. This is normal. This is what happens when we are giving a vaccine that's going to build a response. You're asking your body to respond to it, and it's to build that immunity so that your body can then fight off the virus if it gets that in the future. So your body's working very hard after it gets the vaccine to build up those immune markers so that it can be ready in that realm. And so what does that look like? Sometimes it's fatigue, you're tired, fever, headache, chills. Usually it lasts only that first day, sometimes up to 48 hours. But the reports and the individuals I've all talked to, my own experience is usually just within the first day or two. And then that would typically go away. The virus itself, there is no live virus in this vaccine. And so there is no chance of you getting the virus from the vaccine. That is just your body's response to this vaccine and building that immune response. I wanted to show you just a little bit of the clinical trials, and this may be more information than you want, but if anybody's interested, I'm happy to talk about it. This is the Pfizer vaccine. So those phase 2, phase 3 clinical trials we just made mention of, there were 43,000 people in this clinical trial. 22,000 of them got a placebo, meaning they didn't get any vaccine at all. They didn't know that, but they were injected with something, but there was no drug in it, so it was a placebo. And 22,000 people got the actual vaccine. And it was then those individuals were watched and carefully monitored over the next couple of months. And in the placebo group, 162 of them contracted COVID. 9 of them were contracted severe COVID during that time. For the vaccine group, only 8 of them contracted COVID, and only 1 of them was severe. No hospitalizations and no deaths due to COVID for that vaccine group. As a result, compiling all those numbers, it was shown that this vaccine would be 95% effective based on those numbers. Now, the trials, as you can imagine, are extensive. There's a lot more details in that, but that's kind of the high level of that, and happy to explain anything else if you'd like to. The Moderna, very similar, 30,000 participants, about 15,000 participants in each, the placebo and the vaccine. When those who had the placebo, so they had no vaccine given to them, 185 of them contracted COVID, 30 of them were severe, and 1 of them died as a result of COVID. For those who received the vaccine, 11 people contracted COVID and 0 people contracted any severe and no hospitalizations and no deaths. So this vaccine was found to be 95% effective. The Johnson & Johnson vaccine, did I just fly by it? Yes, I did. So let's jump back to that. So 39,000 people in this study, about 19,000 in the placebo and 19,000 in the vaccine group. Here we had 195 people get the actual COVID virus, 34 of them severe and 7 deaths. But those who got the vaccine, 66 got the disease, but only 5 were severe. And again, 0 hospitalizations, 0 deaths. So that's why you'll see the Johnson & Johnson vaccine, you might have heard this on the news in various places, that it's shown to be 66% effective. And so some initial responses, wow, what about the other 2 that are 95% effective? And this one's only 66. But I think the important things to realize here, 85% effective against severe disease. Again, 0 hospitalizations, 0 deaths. So yes, you might have had more people who contracted the COVID disease, but mild symptoms. Also, something very important in the Johnson & Johnson clinical trials is that these clinical trials happened later, when some of the variants had come out by then. It was also, some of the testing was done in South Africa. All this testing was done in numerous countries. And so sometimes we will see, you saw more challenges with the variant at this time frame. So could actually be better than the other 2 vaccines, but since it was tested against the variant, the other 2 were not. So we don't have that data for a true head-to-head comparison on those. So Johnson & Johnson, very strong vaccine. Actually, we just did a COVID vaccine trial, or sorry, a clinic just 2 days ago with the Johnson & Johnson vaccine. It's a wonderful advantage because it's only 1 dose. And those who are very nervous about taking needles or having needles, this is a great option for you because you only have to do it 1 time, 1 dose. The vaccine cannot give you COVID. We made mention of this, that there is no COVID in the vaccine itself. There is no virus there. So it is a harmless protein. It stimulates the body to create a response, an antibody to this to the vaccine itself, and that fights off the vaccine, or sorry, fights off the virus if you get it in the later time. The vaccines can also not change your genes. There's been some conversation about that, of people concerned about what is the mRNA and how does that work. The mRNA acts as kind of an instruction book. So this tells your body what to do. It doesn't change your DNA. It can't do that. That's not a mechanism by any means to be able to do. It cannot change the DNA or the genetic makeup. Your body will take this instruction book and basically dispose of it when it's done. So think of an instruction book you crumple up and throw in the garbage can when you're all done with it. And that's kind of the response of the messenger RNA. Few other things about the vaccine. It's free. There's no cost to you. So that's a nice thing. Sometimes when you go for to take the vaccine, the pharmacy or the health department or wherever you go, they may ask you for your insurance coverage. There can be a fee for the charge for actually administering the vaccine, but this charge will not go to you. They would then bill your insurance potentially for that. And a lot of places aren't even billing it to the insurance. So if you don't have insurance, that's perfectly fine. Then there is no charge at all. If you have insurance, they might bill your insurance that small fee for administering it, but even that, most places aren't even bothering to do that as well. So no cost at all, but that is why they are asking for your insurance card in case you're interested in that. There are some different websites that you can go to. The New York Gov/vaccine website gives you opportunity to learn a little bit more. We used to look here for eligibility, but now everybody above the age of 16 is eligible, so we don't have to worry about that. So that's a nice piece. The biggest challenge now is finding an appointment to get the vaccine. So pharmacies, your local health department, your doctor's office, the hospitals, pop-up clinics. So keep your eyes and ears open for different sites that are coming, and you can always check with your provider, your local doctor. You can always check with your pharmacist. There's also a great website in the Finger Lakes vaccinehub.org, which can also give you different sites where the vaccine is available. Of course, you can go through the New York Gov website, which also has sites that you can sign up for, both at the Dome in Henrietta in Monroe County, and also the Hawkeye site in the middle of the Center City, Rochester. So those are 2 government sites. There's also one out in Syracuse if you want to drive out a little bit east, and you can go to the state sites also. So tell your friends, take a selfie of yourself getting the shot, put it on your social media. You can call, this is another number if people want to find out information about the clinics, but share this information, share it with others. There is a lot of different information out there. So try to get information that is reliable, talk to people that you trust, and then make your decisions and find an appointment. And we hopefully get this whole COVID virus behind us so that we can move forward and be together with our friends and families and have events all throughout the year again. So let me pause there and ask if you have any questions. I'm happy to take questions from anything I've mentioned or even anything I haven't mentioned that you'd like to hear more about.
Well, one question is, anything I've seen or read is that 6 months at the most right now, it's what they're saying it's going to last. Are we going to is this going to become like a flu vaccine, or are we going to have a titer to see if, or something like a titer to see if it's building up in our system? What's the process that do they think at this point?
Yeah, it's a great question. So we're waiting to learn more about it. And I think there are those tests and those continuations, that phase 4 clinical trials and additional studies that are going on. We're learning as we go along. So that is a very valid question at this point, and it may be the case that we may need boosters. We may need to have one every year or every so often. I think there's a lot still we don't know about variants. Yet I will say that the variants that we're showing, it's not in the same way that it's that we're seeing with the flu vaccine, where we know every year we've got to have a new flu vaccine. It's not that bad, but there is a chance that we may need to have boosters. We may need to have additional ones. So right now it's holding at least 6 months, but I think it's yet to be seen how much longer that will be. And hopefully we won't, but I think, you know, if worst case scenario, we go once a year like we do for the flu vaccine and do this, then I guess we could live with that. It's not convenient, but it's at least something. Yeah, great question. We're watching it carefully. Yeah, great.
For anyone that might have had a mild case of COVID recently and they've recuperated, is there a specific amount of time the person should wait until they would get a vaccine?
Yeah, great question. I don't know if there's exact date, number of days. I've heard a few different pieces on that. I would say to follow up with your provider in those questions. It's you want to make sure that you are completely recovered. And if you, as we mentioned, if you've had some of the drugs associated with treatment, then there is specific guidance in that 90 days beyond. I'm not sure there's such specific guidance on the end of COVID. Also, when is the end of COVID, which is another question. When you're feeling better, when you've been tested negative, you know, typically we've been saying, 14 days beyond individuals who've had other vaccines or have other scenarios. So I would think a minimum of 14 days, but I'm not sure if there is a specific number on the number of days post infection.
Okay, thank you.
Yeah, great question.
Is anybody else?
I think I probably got like a 3-parter there. My husband had Moderna. I had Pfizer. My husband only had like sore arm. My second shot, it was like I didn't have anything at all. So, and I know I talked to other people who had like a varying degree of side effects. And then my sister-in-law doesn't want to get the vaccine. So are there precautions then that for her and for me, if she decides not to take it? And I guess it's actually only 2 parts.
Okay, great. Yeah, so your comment about different side effects with the different vaccines, and they really do impact people differently. So even in my own family, I think we all got a different vaccine. And the vaccine is one part of it. I would say the bigger part of that is the individual themselves. We respond differently, and why one person responds one way and another person responds another way is not clear. In fact, even I gave the scenario of my mother just ago. So my mother has some pre-existing condition, tends to have other complications. And I thought, oh my goodness, if she gets COVID, she's in trouble. I thought, she's probably not going to do very well with the vaccine. She got the vaccine. She had absolutely no side effects. And either time, the first dose or the second dose. Myself, so now I'm 20 years younger than her, yet I had some headache. Didn't feel so great. I took a nap that afternoon. So it's a mild effect to me, but that was it. Colleague of mine about my age had a low-grade fever for 2 days. Other people, nothing. But I have read and have heard that actually they're seeing less side effects in older individuals, which was exactly the opposite of what I might have anticipated with my mother in that scenario. But once I heard that and had read that, I thought, oh wow, it's exactly what I thought in my own home. So it is interesting to see, but really everyone is experiencing it a little bit differently, and just be prepared for that. I was talking with some of the school teachers, and they were saying in the school district that they're actually allowing some of the school teachers to either have a day off or plan for the day off after your second vaccine, just in case, because I guess they don't want so many people having, subs planned the morning of the vaccine, so they're trying to plan for that. And most of them are doing fine through it and didn't need the day off or just took a half day. But even planning for that ahead of time, if you're getting the vaccine, get it on a Friday if you're working, and maybe you can have Saturday to recover if you need to. If those things going on. And then the second question you had about your family member who's not going to get the vaccine potentially. Well, first I would say please encourage her, and based on your own experience in those realms. But if there's a situation where she can't for a medical condition or whatever, her decision is in that. Then she is still susceptible to the disease. And so I would say you as a vaccinated individual could still carry it. Again, may not see the effect. It may be asymptomatic, or you may be in a situation where it's very mild for you. And so then we still risk the fact of you giving it to your sister or your friend or family member who you are with. And so they're at significant risk as opposed to you. So what it is recommended at this point is if you are with unvaccinated individuals, then everybody should still be masking and keeping distance and reduce socializing. So what they're recommending now is that individuals who are fully vaccinated can gather and can be unmasked and can be together. But if there is one individual within the group is unvaccinated, then really everybody should remain masked.
Thank you.
One other question. My mom got she got the Moderna. She got the first vaccine, and about a week later, she got really sick. We don't know that it was from the vaccine. We don't know that it wasn't from the vaccine. But she chose not to get the second because she dropped to 95 pounds. She had a lot of fluid retention. Wow. The oncologist, the cardiologist, and the gastro people couldn't find any reason for it. So she chose not to get it. If you worry about your parents, and
Absolutely, yeah.
If she has to start again, I'm guessing, all over again. Would she have to go with the Moderna again, or is it kind of like out of her system and she could do the Johnson & Johnson, a one shot at this point?
Yeah, that's a great idea. Yeah, so time will pass. She has built likely some immunity with the first dose, but it's only up to a limited amount. And so everyone's a little bit different, each one of the vaccines, and still some of that data coming back as well. So yes, it'll start to reduce over time. And then again, all the conversation around the variants and time and all of those things happen. So she's never going to reach the capacity that you would have with the second dose. So over time, yes, it would be better for her to basically start over. So she could start with any of them. If she continues on with the Moderna, she might build more immunity, but then she's still going to probably need 2 doses, because again, you're not going to get all the way there. You want that second dose, which in her case might be the 3rd dose. So it would be perfectly fine to take the Johnson & Johnson at this point, and then get 1 dose, be done, and she would be set. So absolutely.
All right. Thank you.
Yeah, absolutely. Great questions. Good. Any other questions?
Thank you, everyone. This has been a great presentation, and everybody had such good questions.
Very good.
Thank you so much.
Thank you.
Yeah, wonderful. Thanks so much for having me. And we are happy to be a resource for you here at Common Ground Health. And the Vaccine Hub is a tremendous resource. So please don't hesitate to reach out to us again. We can always send someone else from the Common Ground Health. If I'm not available, there's a whole group of speakers who come from all different backgrounds and perspectives, and happy to have someone share if that's of need in the future. So thank you for the opportunity to letting us share today with you.
Well, thank you. Thank you for making time
you.
for us. You have
Great.
all have a nice day, everyone.
Thank you.
All right.
Bye.